Hello, I'm Professor William Choi, admissions tutor of the BSc SLP program, and welcome to my talk today. So today I'll basically talk about our goal to help our students become a competent speech-language pathologist, SLP, and the future leaders in the field. So here's a program video showing how we do it. Okay.
The Bachelor of Science in Speech-Language Pathology is a 5-year full-time program that prepares you to become a speech therapist. Our program is unique in providing a bilingual learning environment where you can learn and practice in both English and Cantonese. Our program is fully accredited by the Hong Kong Institute of Speech Therapists. Upon graduation, you are immediately eligible to apply for registration as a speech therapist in accredited register.
Our program focuses on the translation of theory and research to clinical practice. Throughout the program, you learn about communication and swallowing sciences and disorders in children and adults. As your studies progress, you start working with pediatric and adult clients. You'll also undertake 2 capstone courses that include the study of complex communication and swallowing disorders. Finally, the 5th year of study includes clinical placements in various settings and a research project based on the interest. Our program features an innovative simulation clinic that was designed to fully prepare students for real clinical placements. We offer various exchange programs overseas and in mainland China. Once you graduate from our program, you'll become a speech therapist. A speech therapist is an allied health professional who diagnoses and treats communication and swallowing disorders. Our clients range across the lifespan, from infants to the elderly. Our graduates work in various settings, including hospitals, non-government organizations, educational institutions, and private clinics.
The BSc SLP program offers the best opportunities to fuse evidence and practice. I love being able to learn about the most up-to-date theories during lectures and applying that knowledge in our clinical practicum. It has helped me understand how we bridge the gap between reading notes on a page and making real-life changes in our clients. Also, sharing most of my time at HKU with a tight-knit community of like-minded students and professors gave me a strong sense of belonging. Together, we foster a sense of collaboration and camaraderie crucial to the community-driven nature of a career as a speech therapist.
I'm currently working as a school-based speech therapist in both primary and secondary mainstream schools. My caseload includes students with different special education needs, such as those with autism spectrum disorder, attention deficit hyperactivity disorder, and other special learning difficulties. I especially want to thank Hong Kong U for my placement arrangement with the Education Bureau during my study. I was able to follow the supervisors there to visit different schools and meet students with different needs, such as those with language, articulation, voice, and fluency problems. With a variety of hands-on clinical practicums in different settings, students in our program are able to have a taste of different working settings, which makes it easier to choose the settings they are going to opt for in the future.
Ready to make a difference? Join us and embark on your journey to becoming a professional speech therapist.
Okay, so now I'll talk about some key ingredients to become a competent SLP. So SLP means speech language pathologist. It is a professional name that is used interchangeably with speech therapist. So when I talk about ST or SLP, they're basically the same thing. All right, so in order to become a competent SLP, you need to have very strong communication skills because we work with 2 different types of disorders, communication disorders and swallowing disorders. We need to help people to get through the messages, and we also need to explain some findings to parents to caregivers in a way that is comprehensible. And in addition to that, we need to have a strong analytical mind because SLPs and STs, they're a professional. So it's not like we have a clinical cookbook. Okay, if you're this, then I'll do this, not like this. So everything changes and we need to adapt to the situation. So it's important for us to analyze the functioning level of the patients and to prescribe the appropriate intervention. And of course, we're a allied health professional, so we need to have a helping heart and we need to enjoy working with people. And at last, we also need to have good listening and observation skills because all these are very necessary for you to provide a holistic service to your patients, your clients. And if you're interested in knowing more about the key ingredients, you're welcome to refer to this talk that was given some years ago. Okay, so here's our curriculum structure. In the first 2 years, we call it the foundation year. So before learning about some communication disorders, swallowing disorders, we must know how a typically functioning individual would do. So in the first year, we would learn about human development, anatomy, and physiology. So basically like biology class, reciting those muscles names, bone names, to understand how our body helps us to produce speech. And we also have clinical linguistics. For example, I'm teaching phonetics. So basically, how would you transcribe speech sounds? And we would have a brief introduction to communication disorders, basically for you to have an idea of what kind of clients you would encounter in the professional life of SLP. And in year 2, we would have speech science. Basically, it's like physics. We're talking about sound waves, fundamental frequencies, Fulman frequencies, intensity, decibels, all these very technical area of speech. And then we would have neurology and neuroscience. So basically, we'll learn about our brain. So how would your brain function when you speak? And then we would have cognition and language processing. So more or less like the neurology class, but with a stronger focus on the linguistic functions of your brain. And then we'll talk about evidence-based practice, which is more clinically oriented. And then we'll have research methods and statistics. Basically, this is to prepare you for your final year research project. And then we'll have introduction to clinical practice, basically to give you a rough idea of what you would encounter in year 3, 4, and 5. So in year 3, we call it the pediatric disorder year. We'll start learning disorders. And in year 3, we would focus on children. For example, we have speech and language development and disorders, voice disorders, audiology, and oral rehabilitation. And then in addition to these theoretical courses, we also have a complex case course. So in that complex case course, students would be given some hypothetical cases. For example, Mary is a 5-year-old girl. She's still using single words to communicate with her parents and this and that. So what kind of assessment tools would you utilize for this case, and what kind of intervention would you provide? How would you explain the findings to the parents? So this is to help you prepare for your actual clinical placement, because there's always a gap between the theory and the practice, and this course actually serves as a bridge between them. And then, of course, you will have your clinical practicum in the pediatric setting. So after you have learned the theory and after you have that bridging course, you would be exposed to some real clients. And as you progress, you would reach year 4. And in year 4, we would focus on adult disorders. So we will have aphasia. So for example, if someone has a stroke, they may have some language processing issues. So we call these aphasia. And we also have motor speech disorders. So maybe when some people have some traumatic brain injury or have a stroke, it would affect their speech functioning. They would run out of breath easily, or maybe they would speak with a very small or very loud voice. So speech disorders. And they might also have problems with swallowing. This is why we have swallowing disorders as well. And we also have fluency, laryngectomy, and craniofacial disorders. For some patients who have NPC, like nasopharyngeal cancer, they would have their voice box removed. So without vocal folds, how could they speak? So we will learn about this in year 4. And then we would have adult complex cases course. Basically, again, it is a bridge between theory and practice. And after the complex cases course, we would have the clinical placements in various settings like hospitals, NGOs, and elderly homes. And in your 5th year, we call it the interprofessional year. So in this year, we are also learning how we could work with different professions. Like, for example, in the hospitals, we need to work with ENT doctors, we need to work with neurosurgeons, we need to work with nurses, or we may need to work with dietitians and occupational therapists. So basically, we need to learn how we can collaborate with these people. And not only in the hospitals, we also need to work with teachers if you work in the educational settings. And so in your 5th year, you have some opportunities to learn about these. And the highlight of the 5th year is, in fact, a research project. So in your 5th year, you would be able to pick a research topic of your interest, and then you can develop a research study based on that. And you also have advanced clinical placements. So we would assign students with children placement and also adult placement. Okay, so in your first 2 years, we would provide you with opportunities to observe clinic. So basically, your senior students would be doing their clinical practicum, and you would stand beside and watch how they're doing it. And as you acquire some experience in your year 3, 4, 5, we would have actual clinical placements for you. And so how do we nurture our students? Our students are actually very well known for having a strong theoretical knowledge. And we help our students reinforce theoretical knowledge across years through spiral learning. So what does spiral learning mean? Let's say in year 1, you would learn a theory, and then in the next year, you would see the same thing in the clinical setting, and you would come back to the theory. And as you go to year 3 again, you have your clinic, then you will also see something related to the theory. So this keeps coming back. We call it spiral learning. So in your clinical practicum, you will complete more than 300 hours of direct clinical contact under the supervision of an experienced clinical educator. We have some in-house educators and also some external clinical educators. For example, in Queen Mary Hospital, Prince of Wales hospitals, some private clinics, and also NGOs. So we have a lot of different settings, and we also put a strong emphasis on evidence-based and scientific practice. So we ask our students when they work, they should have a literature and evidence from the scientific aspect to support their clinical decisions. And we have an internal clinic at Kennedy Town Center, so it's not so far from here. And we have some dedicated clinical rooms and a lot of different resources. And I think the year 1 students, they already have, before they formally enter our program, they would already have a clinical visit. And externally, we also have many clinical sites at preschool centers, kindergartens, mainstream special schools, NGOs, nursing homes, rehabilitation centers, hospitals, and government organizations. So An important feature in our program is that we have numerous opportunities for experiential learning. It is, first of all, embedded in coursework. For example, in my phonetics course, I do ask my students to have a group project. So basically to analyze the speech of children versus adults or native speakers versus non-native speakers. So I remember I had a group of students, they were analyzing the differences between an Indian speaker and a Cantonese speaker in speaking Cantonese or in speaking English. Okay, very fun. And there are also numerous events like School Fun Day, World Voice Day, and World Swallowing Day. I remember in one of those days, we do have a day that asks our students to drink only water with thickeners. Like whatever you drink, whatever you eat, add thickener. So you would know how the actual patients at hospitals would feel when you prescribe them with thickeners. So we also have some different external organizations and clinics for our students to visit. And we also have exchange opportunities. For example, we had in our past year Wuhan, Shanghai, and Australia, Canada. So a lot of different places. Okay, so here's the Juro Technology Center that our students were visiting. And we also have in our fifth year, we have interprofessional education. So we would be pairing with the Faculty of Medicine in, for example, discussing a possible case on adult dementia or a pediatric case on developmental delay. So you'll be sitting with medical students, nursing students, and education students all talking about the same patient or the same client. And since COVID, we have also developed a telehealth clinic. So basically, we're trying to equip our students with the ability to conduct speech therapy outside the face-to-face context. And this is also a kind of new initiative in our university, which is known as Simulation Clinic. Because before the students go to the clinical placements, they're often very anxious. Okay, they didn't know what they should do. So we have this simulation clinic. We have actors and actresses from APA, 演藝學院. They would come over here and act as if they were the patients, and then our students would practice some hands-on skills with them without worrying to, to harm the patient. So this is quite a new initiative, and our students have provided excellent feedback on that. And in your year 5, you would be able to conduct a research project, and you would be assigned to different research laboratories. For example, if you're interested in hearing, you could do some hearing research. You're interested in doing swallowing, you can do swallowing research. If you're interested in like neuroscience research, we also have a lab about that. And we also have some research overseas programs like the Late Law and University Research Fellowship program. So basically, they would provide you with money, free ticket, free hotel. They would send you abroad, and then you can do some research studies. And our students are actually really good at research. And as you can see on the right, they have published some papers at international journals. And we also have some innovative aspects in our program in terms of entrepreneurship. So as you can see here, some of our students, they have developed an AI app for screening for speech disorders. Yeah, and we also have a student winning the top 10 Outstanding Tertiary Student Award, which is remarkable. So we have a lot of bright students here. Okay, so now admissions requirements and application procedures. So for the coming year, we have 48 places, and there's no fixed quota for JUPAS and non-JUPAS applicants. All of them must attend an interview, and we only consider applicants who put us in their Band A choices if you're a JUPAS student, and if you're a non-JUPAS student, first choice. For the interview dates, we have already completed the SINDAS and non-JUPAS interviews. And for the JUPAS interviews, it's going to be on June 18 and July 24. So only one interview is required per applicant. Like if you're invited to the first one, then you wouldn't be invited to the second one, vice versa. And we're looking at the best 5 subjects. If you're a JUPAS applicant, we only consider category A subjects, including M1, M2. And your English must have attained the level of 4 or above. And we count all subjects equally. And in the past year, 2024 to 25, the lower quartile was 32, median was also 32 for best 5, and upper quartile 34. And below is the formula for calculating the scores. And some tips for your interview. We'll be conducting a group interview, and we look for students with strong communication skills, not only in Cantonese, but also in English. And you must have a strong analytical mind, and we also look for students with logical thinking. So, for example, in one of the past years, we had a question, okay? You have a 4-year-old cousin with autism spectrum disorder. Please choose among these 3 birthday presents you would like to give to him. So maybe A, Lego, B, a knife, okay, and C, chessboard, okay? So what kind of gift would you give to that cousin? So by discussing this, you will actually show your understanding of autism spectrum disorder, and you will also show some critical appraisal of people's standpoints. And of course, you must have good listening and observation skills and ability to work with people. And some don'ts, okay? Please try your best to engage in the conversation. In the previous years, actually, most of our applicants, they actively contributed to the discussions, and we have not seen any people who kept silent all the way. I mean, you're a speech therapist, you must talk, okay? Don't be dominating, let people talk. Don't be too aggressive or confrontational. Try to be cordial. If you don't agree with people, how would you do it diplomatically? Use some soft skills. Not following instructions and dismissing others' opinions. Okay, so how to prepare yourself? You can study the information we provide on the website, or you can follow our IG. So from time to time, we do post some information about our program and also some tips. So make sure that you're following our IG. Okay, so now it's my student's turn to share about his learning experience in our university. So let's give a big hand to Alex.
So thank you, Professor Choi. Hi, I'm Alex and I'm from Year 4. And today I'll be sharing my wonderful journey in this program with all of you. So I want to begin by asking you this. When you hear the term speech therapist, what comes to your mind immediately? Do they only teach people how to speak or improve people's communication? So actually, we provide assessments and treatments to a wide range of patients, including obviously speech and language disorders, and also social cognitive communication disorders seen in children with autism. We also provide our services to the elderly patients, the adult patients with vocal and swallowing problems. So you can see we really have a lot to learn in these 5 years. So what will we learn? At the top, you can see some weird symbols, right? No, this is actually the International Phonetic Alphabet, the IPA. Each of the symbols you can see up there represents a sound you will find in the English language. So can anyone guess what the IP spelling on the right means? I heard the sound. It's therapist, exactly. Yeah. So by understanding the sounds in each word, you will definitely improve your articulation and, of course, the client's articulation. Besides the articulation, we will also analyze Chinese and English sentences and clausal elements you can see down here below. Besides linguistics, we will also explore the anatomy, kind of a medical side to the head and neck region, including the muscles, the nerves, and the glands. So I have here 2 models to show you. So I'll bring it here. The first model is about the head and neck. So you can see there's a lot of features. For example, we will analyze the brain. So what part of brain is crucial for initiating speech, for controlling our motor actions, and also for receiving, for understanding the language. So we will learn about the brain, the structures, and cognition. And also you can see the tongue part, the mouth part, and so-called pharynx and larynx, our neck part. This is crucial for swallowing because we need to use a lot of muscles and a lot of nerve to innervate for completing the swallowing action. So it is very important that we know the anatomy. Of course, speech therapist uses the voice, right? So the second model here shows a deeper look into the neck region, the larynx region, where you produce your voice. So I'll just hold it here. So you can see the blue one is about the vocal cords, the vocal fold, which we use to produce our voice. Of course, we will also analyze, how high our pitch will go, or what are the acoustic signals that males and female sounds will produce, etc. So to be honest, studying anatomy was quite challenging for me at first, even though I studied biology in secondary school. There's a lot of things to catch up and learn. However, every SLP student, we need to go through and overcome this topic as the knowledge is really important for the upcoming clinic, especially the Year 4 clinic, which I'll be sharing in just a moment. So in Year 3, we'll be having our pediatric clinic. You can see some pictures in the clinic room and the many more toys we'll be using to play with the pediatric clients, okay? So you can see a picture of me with one of my pediatric clients. I remembered he was kind of, mischievous at first, not gonna lie. He was always running around, jumping up and down. But through games and fun competitions, I channeled his so-called playful spirit into the energy, the motivation for completing the session, for improving his articulation. And in the end, he did it, and it was really memorable. And you know what? Till this day, I do still think of him, and I do miss him a little bit. Yeah. So I'm sure you will all enjoy this process and have a wonderful connection, a wonderful bond with the clients as well. So in Year 4, we'll be having our adult clinic in locations such as rehab homes and elderly centers. And we provide assessments and treatments to those with vocal and swallowing problems. So speaking of swallowing problems, I actually have something to show you. So just follow me here. So yeah, thank you. So come this way. You can see there are 2 cups of water here. One with normal water. Okay, you can see just normal, drinking water, and one which is thickened water. You can see it's very viscous. Okay, so have you ever wondered why speech therapists need to add the thickness to thicken the water? Just a wild guess. That's okay. Oh, I see someone.
To experience what the patient feels.
Yes, of course. As Professor Choi mentioned, we have a simulation session where you use the thickness to add and thicken the drinks to experience what the patient feels like. But for real patients, we add thickness. The reason is because thickness, as this is the thickened liquid, it flows more slowly. So it allows more time for the elderly to prepare the swallowing actions, and it reduces the risk of choking. So it's actually really easy to make the thickened drinks, and I'll show you now. So there are two types of thickness. There are starch-based thickener, which is the yellow one you see here, and there is the gum-based thickener, which is the blue one here. So whatever the type of thickener, you just follow the instructions on the can, on the label, and you just add, scoops of thickeners into the drink, add a few scoops, of course, following the labels, and you just stir until you make your desired consistency. Yes, it's that easy. So I'm sure all of you will be able to do it when you're in the clinic. So after a while, you can see it's gradually thickened. Essentially safe swallowing for the elderly, okay? It's more and more thickened. So you can even add the thickness into the drink of your choice, be it lemon tea, milk tea, soya milk. Yes, so the elderly have more enjoyment in, even though they are using the thickness to drink. So there are also these small sachets. Tiny sachets here. Okay, so it's really handy. You can put it in your pocket, you can put it in your bag, in your clothes when you go and drink. So, okay, now I'll stop talking about thickness, else you'll think I'm a salesman for thickness. Let's talk about something else, okay? Which is exchange programs. Yay, everybody loves exchange programs. As Professor Choi mentioned, we can go to mainland China, Southeast Asia, and even other parts of the world. So you can see my face here, obviously. Okay, just last Christmas, some of our students and me, obviously, went to Shanghai to learn more about aphasia, which is a type of language disorder. And we also looked at the latest tech for treating these kind of disorders, which was really eye-opening, and it was really wonderful. So coming back to our class, we have a small class size of about 50 students. And guess how many male students are there? 20? 10? No, it's 6. Yes, you heard me correctly. It's 6 male students in our class, and the rest 40-something are females. Males are like those rare Pokemon characters in Pokemon Go. Yeah, they're really hard to find. So, jokes aside, we have various fun activities such as the O Day, which you can join to meet new friends. And there's also Speech Action, which is a social service group run by SLP students. It offers many voluntary activities for you to join, such as helping the elderly, helping the ethnic minorities. And after joining their programs, after joining the activities in year 1 and year 2, I was definitely more prepared for the upcoming clinical years and to become a competent SLP student. So that's all from me today, and see you around the campus. Thank you.